What are hemorrhoids or piles? Hemorrhoids are vein blood vessels within the walls of the rectum and anal canal. Hemorrhoids are also known as piles. The hemorrhoids or piles will occur when the vein blood vessels become swollen. How are the hemorrhoids or piles classified? The piles or hemorrhoids that occur in the rectum are called as internal hemorrhoids, and the ones that occur in or near the anus are called external hemorrhoids. According to the degree of severity of hemorrhoids, internal hemorrhoids can be classified into the various categories like first, second, third, and fourth degree categories. The first degree internal hemorrhoids always remains inside the rectum. The second degree internal hemorrhoids. This type of hemorrhoids tend to come out of the rectum during a bowel movement and then return to the inside of the rectum after the bowel movement on their own. The third degree internal hemorrhoids extends outside of the rectum during a bowel movement, and they need to be pushed back into the rectum after the bowel movement. The fourth degree internal hemorrhoids. This type of hemorrhoids always remains outside of the rectum irrespective of the bowel movement and cannot be pushed back into the rectum. How is hemorrhoidectomy done? The hemorrhoidectomy is a surgical procedure to remove the hemorrhoids or piles and is done under the local or general anesthesia as required. Procedure. You will be given anesthesia medicine by an anesthesiologist through a breathing mask or IV line for the hemorrhoidectomy procedure. A breathing tube will be inserted through your mouth and into the windpipe to help you breathe during the operation. Surgeon will begin using a scalpel, electrocautery, or laser to make an incision in the tissue around the hemorrhoid to expose the swollen vein. Surgeon may tie off the swollen vein in order to keep it from bleeding when it is removed. Swollen vein and inflamed tissue will be removed. Medicated bandage may be placed over the wound to aid in healing and protect from infection. Hemorrhoidectomy procedure generally takes about an hour. Recovery period. Recovery period following hemorrhoidectomy procedure may be anywhere from a week to a couple of months depending on the case. Diet after hemorrhoidectomy procedure. Drinking plenty of fluids and or following high fiber diet is advised, and it is important to follow post-operative instructions given by surgeon. Post-operative instructions. Call your doctor or emergency immediately if you feel fever, redness, drainage or leakage from wound, extreme pain, or show any signs or symptoms of post-operative complications